Faced with 12 new cases, more than 10,000 close contacts and 150 exposure sites.
Unless something drastic happens, this will become increasingly uncontrollable. From 11:59 p.m. tonight, Victoria will enter a 7-day circuit breaker lockdown.
And with the latest outbreak spreading in part via eligible but unvaccinated over 50s, the acting Premier didn't hide his frustration with the federal government.
If more people were vaccinated, we might be facing a very different set of circumstances.
The challenges that the Health Minister in Victoria and indeed the acting Premier noted about the program to date related to the supply issues out of Europe and the advisory groups, ATAGI's advice regarding the AstraZeneca vaccine.
There are 237 aged care facilities in Victoria in which people have not been fully vaccinated. There are 29 of those facilities haven't had a single dose. That's not good enough.
The other bugbear, hotel quarantine.
The reason why we are dealing with this outbreak today is because of a hotel breach in South Australia. That is not a criticism, it is just a fact.
That breach was the 17th in 6 months. 6 months in which the federal governments resisted calls for a quarantine overhaul.
That has delivered a 99.99% effectiveness rate for quarantine in this country. That is just a simple fact.
I have raised the issue of Commonwealth quarantine facilities for a year, regularly.
Hotels were not meant to be this line of defence against an infectious disease.
The simple reason the Commonwealth doesn't want to do it is because it's risk. It's risk. And it's work. And it's hard.
Today, the PM made promising noises on both the Victorian remote quarantine proposal.
We are highly favourable towards this. We think it can be done actually quicker.
And ramping up the rollout.
I am pleased that the numbers each week have been growing and growing and growing. It wasn't that long ago we were talking about weekly vaccinations of around 350,000. Now we're talking about well over 500,000.
But for Victoria, it's too little, too late.
If we had an alternative to hotel, we would not be here today. If we had the Commonwealth's vaccine program effectively rolled out, we may well not be here today talking about these circuit breaker restrictions that we must impose to keep our community safe.
We did try to get some answers from the Prime Minister, also many of his ministers tonight, but they didn't want to step up with any answers. So at a moment like this, they couldn't find a single person to speak to us. Fortunately, epidemiologist Professor Tony Blakely is more forthcoming and he joins us now. Professor, 25 cases now, roughly that at least in this cluster, but 10,000 close contacts that we know of and all those exposure sites. Do you think realistically that 7 days will do the trick?
The honest answer is, I don't know. I hope it is. However, if we look at it like this, the going up in the cases here, with the contact tracing and the lockdown, the contact tracing is so much better than last year. With those two things, we should turn it around. Second point is if we think back to the modelling that myself and others provided to the Victorian government last year in our second wave, we said once it gets down to 5 cases a day on average for 2 weeks, let's say for 1 week, we can then pull back. Now, whether or not we can get down to an average of 5 cases per day by a week from today, I'm really not sure, but that's what we should have in the back of our minds. 7 days, I hope it's enough, but I can't guarantee it.
So, Professor, is this lockdown ultimately due to the failure of the federal vaccine rollout?
Well, I would say it's ultimately responsible from the failure of South Australian and the quarantine. But on the vaccine, if we had had the coverage up from now from, say, 10% to 30%, that may have been enough to give a little bit more resilience to the community that they'd be less likely to pass the virus on, and that may have been enough to stop us getting to this point. So possibly vaccine rollout, but more that issue of quarantine with aerosol transmission. When somebody opens the door, 12 minutes later somebody else opens the door, they get the virus, they then leave quarantine and come and infect inside Victoria. That's the bigger issue right now.
Tony, we've only got a little over 1% of all Aussies vaccinated so far. What percentage do we need to avoid any future lockdowns, do you think?
Well, how long's a piece of string? But if we got it up to a third and 50%, with contact tracing, there'll be flare-ups, but that'll probably be enough to dampen the spread that the contact tracing will be enough. And then when we get up to 80% or so, then that may be enough that we have herd immunity and we're pretty resilient and we can open our borders. We've got a long way to go to 80%, but just getting to 20%, 30% will really dampen things down and help with controlling these outbreaks.
So just thinking about this, I mean, the government didn't put in orders for Pfizer, the federal government that is, when they had the opportunity to put their eggs in the AstraZeneca basket. Then we had the blood clot issue that came with that. We didn't really have a public information campaign that encouraged people to get vaccinated. Clearly, a lot of people who were eligible weren't, evidenced by the fact that we're now seeing all of these queues as people see this outbreak happen. Do you think the 30% that you've identified there that might have made a difference was possible if we'd done this right?
Oh, it would have been possible amongst the 50 plus, at least 30%. But the issue is that it's the younger people, the Uber drivers, the people out and about who are more likely to spread it, the less than 50-year-olds. So until we get their vaccination rates up, that's when we'll start to see real dampening of the spread. So what have we got 30% across the whole population by now if things have gone tickety-boo? I doubt it. What have we got, say, 80% amongst 50 plus and 15% amongst less than 50-year-olds? Yeah, possibly. And it would have helped. But it's getting those young people vaccinated that'll help dampen the spread in the future.
But also you mentioned the quarantine breach, the hotel quarantine breach from South Australia. We've had in total 17 hotel quarantine breaches. Almost all our community transmission has originated in hotel quarantine. State governments have been crying out for a Commonwealth response. So for Australians going into lockdown tonight, should they be laying the blame for that at the door of the federal government?
Let's put the blame side away and let's just sort of talk about the responsibility, a slightly softer word. Myself and others have been saying this for 12 months. I mean, to say, in our textbooks in public health medicine, it doesn't say use CBD hotels for quarantine. We've been saying you need purpose-built facilities for 12 months. We need to crack on and do it. And when we need to stratify, so the people coming in from India, Sri Lanka, UK, countries with high infection rates, they go to those facilities, and we only use the CBD hotel for those coming from low-risk environments like Taiwan, South Korea, that sort of place.
That almost sounds like a plan, Tony. Thank you very much for speaking to us tonight. We appreciate it.
Yeah, I've got a plan.
Yeah, I don't doubt it. Thanks, mate.
Always got to have a plan.
Yeah,
How annoying to live in the most over-governed country in the world, or one of, and that they just, when you need government, they can't do what they need to do. Yeah. Mate, it's infuriating.
And every Victorian has the right to feel angry tonight. 4 lockdowns in the space of 12 months is just untenable, especially when the federal government has been sitting on its hands on this for so long. The confusing messages over the vaccine rollout, the fact that they're not setting up properly to do the mRNA vaccine production here in Australia are just one thing after the other, and here we are again.
I guess if Tony's right that we can't say that any of that would have changed the result today, and we don't know that, so let's assume that that wouldn't have changed it. At the very least, let's hope this is such a serious wake-up call that you get warp speed on it now, because that's what's been missing.
Well, judging by the response today, just talking to people, and the fact that phones were basically, you couldn't even get through because the demand is so high. Let's hope that is a good sign and people persist and continue and get their vaccination. And also the testing, like 40,000. I know vaccinations, people are saying, it's all about vaccinations now. It's still about testing. For right now, for this little next period, next week or so, and who knows how long, testing is still really important. So well done, Melbourne, for that many tests as well.
With so much content online, it's sometimes hard to keep up with it all. And let's face it, who has the time? The Project YouTube has you covered with the stories that matter. Hit subscribe for a daily list of the news that you need to know.